This vaccine equity video series is produced by the Public Health Alliance of Southern California. Our series elevates promising and replicable practices for equitable vaccine distribution. Practices happening both here in California and across the nation. Our video series will showcase community-informed and equity-centered practices that specifically aim to reach disproportionately impacted low-income communities and communities of color. My name is Marley Williams, and I am the Health Equity and Justice Manager here at the Public Health Alliance of Southern California.
And I'm Dana Sherrod, Birth Equity and Racial Justice Manager for the Alliance. The Public Health Alliance of Southern California is a coalition of the 10 health departments here in Southern California. Collectively, our members represent 60% of California's population. In this video, we hear from Dr. Frederick Eccles, the director of the City of St. Louis's Department of Health, and Alana Green, executive director of the St. Louis Housing Authority. Dr. Eccles and Alana discuss the innovative partnership between the Health Department and Housing Authority to host an event that vaccinated over 300 older residents in public housing, 98% of whom were African American.
Dr. Eccles, would you explain a little bit more about the partnership effort from the health department side? What made you think to engage the housing authority in the effort, and what was the role of your department?
And so the City of St. Louis Department of Health, part of our mission is to make sure we are creating opportunities for all St. Louisans to achieve optimal health. Back in January, we published our COVID-19 vaccination survey for individuals to register in the event that they were interested in receiving the COVID-19 vaccine. So shortly after we launched or published our survey, we analyzed the data. And so we looked at where individuals lived and where they were registering. And so what we found was that our most impoverished areas did not have adequate representation. Of the 70,000 individuals that had registered to receive the COVID-19 vaccine, less than 3,000 of those individuals lived in North St. Louis, which is one of our most impoverished areas. And so in this area, we have individuals living in high poverty, a high percentage of individuals who are uninsured or inadequately insured. And so we knew that there was still a need for those individuals to have access to the COVID-19 vaccine. We were also paying really close attention to what was happening in the media, and the message in the media was that African Americans, minorities, didn't want to get the vaccine. And what we found was that that's not true. The issue is the health departments and local governments not effectively engaging those communities and creating opportunities for those individuals to receive the vaccine. And so in my role, I'm very intentional about not just health equity, but health justice. And so one way that we were able to create opportunities for our most vulnerable populations was by partnering with an organization like the St. Louis Housing Authority, who engages these individuals on a regular basis. And so we knew that by partnering with Alana Green and her team, that we would be able to get a significant number of not just minorities, but minorities who were living in poverty and minorities who needed this life-saving public health tool to save not only their life, but the life of their families. And so I reached out to Alana, and she was happy to partner with us. And that was just the first step. So a lot of additional steps had to be completed in order for us to have a successful event. One, we had to do a site survey. We identified the location, which was the St. Louis Housing Authority's headquarters off of Page Boulevard. The City of St. Louis Department of Health Emergency Preparedness Program conducted the site survey and also did additional planning to make sure the workflow was appropriate, so that because we have to also be mindful of the mobility issues that some of our elderly individuals have, and we didn't want to create any additional issues for them while they were coming through our event. So we mapped out the space, staged the space so that it will be conducive for older individuals, and then ultimately we had the event, and the event was amazing. And so one of the things that I took away from the event was, one, again, that was confirmation that African Americans do want to receive the vaccine. But then the other thing that I took away from it is that we have to do a better job of supporting our elderly individuals. Oftentimes we have resources and we have opportunities, but most of those opportunities are not geared towards making sure our elderly population and our most vulnerable populations are included, and so they have an opportunity to thrive even in old age. And so we have to do a better job of that. But overall, again, we vaccinated over 300 City of St. Louis elderly population during that event. Roughly around 98% of those individuals were African American. Again, dispelling the myths that was circulating in the media that African Americans do not want to get the vaccine. But we are mindful of the harms and the issues that have been created by exploitation by not only the hospital systems, medical systems, academic institutions over the past several decades. And so we acknowledge that. And so before we engage our community, we acknowledge the harm that we have caused. And even me in my position, I wasn't here decades ago, but the harm that city government caused, that's part of the government's brand, right? So I have to acknowledge that. For me to not acknowledge that is an injustice in itself. And so we acknowledge the harm that our organizations may have caused in the past, but we use this opportunity to create new opportunities that we can build a better foundation, a stronger foundation for our most vulnerable population, so they too can thrive and have a good quality of life.
So Alana, from your end with the Housing Authority, what did it look like for you to actually get the word out to your older adults and the clients that you serve?
And one thing we knew about our population, our elderly population in particular, is that they weren't really tech savvy. So what we had to do was literally call every elderly resident that was over the age of 65 to see if they were interested. Now that in itself was kind of a feat because number one, it's hard to find phone numbers sometimes. It's hard to get residents to pick up. And so once we got the residents on the phone, another thing to think about is that a lot of the seniors really don't talk to a lot of people. So when they have someone that calls, we can expect to talk to them for maybe 15 to 30 minutes apiece, depending on, what's going on with them. And so really we had all our entire staff calling residents because we needed to get about 600 residents called within just about 2 days. And so we were able to do that. But, again, sometimes their social interactions are limited. And so we were really their social interactions for that week because we called them, of course, at the beginning to see if they were interested and then also towards the end to kind of set up the appointment with them. And I also think it's helpful to have an entity that they trust call. So when they heard the Housing Authority, they weren't really shocked. They thought, okay, well, this is something I'm familiar with. I can talk to them. But if it was someone that they had not known, they would not have trusted them as much. We have an elderly and disabled coordinator who works really closely with the seniors. And so that was another trusted avenue for them. They knew that Marvin, who's our elderly and disabled coordinator, was going to be involved. And so they knew to have that trust kind of, automatically because he's there for them all the time, basically.
To Alana's point, it's really ongoing engagement. And so I think one of the trends in the past, even for public health and for medical providers and hospital systems, is we engage the community when we want something. We want data, we want information so we can use that for our own benefit. And so that's no longer acceptable. So we have to really treat them as individuals who have value and worth in our community. And so that's our approach. But making sure we don't just contact them and engage them during certain circumstances. So when COVID-19 is over, we still need to be able to continue to engage them regularly to make sure they're aware of other public health resources and services that are available through my department or through other departments in City of St. Louis government. There's
definitely value also in having people that in leadership positions that look like our residents be there. So I was at the event, Dr. Eccles was at the event, and people that were administering the shots were also minorities and African Americans. And I think that helps with the trust factor as well. They see people that are like them actually being a part of the process.
You mentioned access barriers as something that you all thought about specifically for older adult clients. What were some ways that you addressed those physical access barriers that you mentioned?
The facility is, we only use the first level of the facility, so people didn't have to travel up and down stairwells or elevators to get through the event. Then the other thing that we recognize, so Alana and her team work really closely with transportation providers. So there are a lot of the seniors who did not have their own form of transportation to get to and from the event. And so we partner with, or they partner with 2 transportation providers in the city of St. Louis who shuttled people to and from their homes and the event. And that was that worked out extremely well.
Could you tell us a bit more about your broader strategy within the city of St. Louis to reach disproportionately impacted people in vaccine distribution?
We'll continue to work with the St. Louis Housing Authority to make sure, again, we are vaccinating as many people as possible. And we're also working with other organizations such as the Department of Human Services. This department provides services for unhoused individuals as well as individuals who are homebound. And so we've already started working with them to have individuals who need transportation to come to our event as well. And so these efforts will continue. And I guess in my role as the Director of Health is not to have one-off relationships, but really to establish strong partnerships, because we have an opportunity to create a new foundation for city government, have a new opportunity to really create different and stronger support systems for our community, especially our most vulnerable populations. We'll continue to do that. And as I tell my staff, if we fail to do that during this time when we're getting additional federal allocations to meet the needs of our community, then that as well as an injustice. And so we can't afford for this to be a missed opportunity to reach our most vulnerable population. So one thing that we also have to be mindful of as a health department is that we have to be mindful of the reputation that other agencies have, because not everyone can be a messenger for your agency. And so as we understand the history of St. Louis and healthcare for indigent populations, it was important for the health department to use this opportunity to really rebrand itself by reaching out to the community directly and doing so in a way that the community knew that we were intentional and we were genuine about our approach. If we're serious about addressing issues related to health and racial injustice, we have to be willing to go against the grain. And so that's what we're doing. It's a lot of work, but if the leaders within particular agencies are willing to champion that work, then their staff are willing to help them lift it. And so that's what my experience has been in the city of St. Louis.